Today, May the 15th, is World Orthodontic Health Day, set aside by the World Federation of Orthodontists to celebrate the specialty of orthodontics. The theme for 2022 is based around the transformational power of specialist orthodontic treatment. To have a conversation around the message of this year's commemoration, we are now being joined by Dr. Amy Traore-Shumbusho. I hope I got your name correctly. A smile designer par excellence and multi-award-winning dentist. She runs a foremost dental facility in Nigeria, Smile 360 Dental Specialist, with, according to her, a passion and mission to transform the dental landscape. Good morning, Mrs. Shumbusho.
Good.
Please say that again. Let me know how to say your name correctly.
Amy Traore-Shumbusho.
Shumbusho.
Yes, you got it right.
All right, thank you. You're welcome. You're welcome to the program.
Yes, thank you very much for having me on the show.
You're welcome.
Thank you very much.
All right, so today is your day.
Today is our day. Is the 15th of May. Is the day that has been set aside by the World Federation of Orthodontists to celebrate one profession that is not known, all right, which is the profession of orthodontics. So orthodontists, everywhere you are, this is your day, all right? Well done. But I'm here to tell the public as well, what is that word? That word, we know dentist, and we think, what is orthodontics, okay? So an orthodontist is a dental specialist, a dental surgeon, who has taken several years, up to 5 to 7 years, to specialize in the diagnosis, prevention, and treatment of what we call malocclusion, which has to do with malaligned teeth, bad bites, just to ensure that you have healthy, functional, and a beautiful smile. So that is, a dentist is the person that takes care of, yes, your feelings, your prevention of your oral health, but an orthodontist goes beyond, ensuring that we give you teeth that function, teeth that look nice, and teeth that you can preserve for the rest of your life. Yes.
That's the thing about orthodontics.
Does that sound like a makeup for the teeth or something?
I'm so glad you brought that up, because we used to say, oh, orthodontics, are they like the cosmetic dentists? And I'm so passionate about the fact that we do much more that has to do with ensuring that your teeth function. Of course, we know as long as we live, we need teeth, right? Because we need to eat. But those teeth are not just there to look good, all right? You need to function. You need to be able to speak. If your teeth are not in the right position, today I'll be lisping. I'll have difficulty speaking on this platform, right? If I'm not able to chew, I will not be able to digest, my breakfast or my lunch. So it's really the functional aspect that people should know about. And that's why it is not any dentist that can do orthodontic treatment, all right? So it's a very specialized field of dentistry. And in the world, it is said that about 6% of dentists are orthodontists. That's in America. In Nigeria, it's about 2%. Only 2% of dentists are orthodontics. So it's so important that we know it's something specialized. And there's a reason why it's specialized, because when you start moving teeth from where nature has positioned it, you need to know the biomechanical forces, the biology, what is sensible to do to ensure that we preserve your teeth and your smile, but mainly for the function.
For the function.
Yes.
We've already touched on the fact that, orthodontics is far more than just cosmetics. As you said, there's a function to them. But it's almost magical in the sense that if we look at traditional train track braces, for example, linear braces, is that what they're called?
We have the metal train tracks, functional fixed braces.
Yes.
I think you had braces.
I have, yes,
I remember that, yes.
I'm actually one of your clients. So if we look at orthodontics, like the traditional train tracks, for example, like you said, they actually move teeth from their natural position to a place that serves a better function. And I'm actually really happy that we have you on the show today, because just yesterday I was on social media and I saw a video of a young person, I believe they're in the States, who put on braces themselves, right? And their teeth weren't bad in the first place, but their bottom row, rather than forming almost like an oval kind of shape, it became a rectangle. And I just wanted to ask you, first of all, how does that happen? And that obviously speaks to the fact that not everybody who's, very, very bright or gifted or even a dentist has the training or the ability to actually take this power and use it well. So talk to us about how the teeth move. How was it that that young person's teeth went from literally a square shape? How can that be fixed, actually?
I totally agree with you. We're in this world where it's all about DIY, right? And of course we have some businesses who are driving orthodontic appliances who are looking at doing business to consumers now and bypassing dentists. So there's a lot that is happening, of course, with digital, right, that enable quite a lot of things. But we have to know that when it comes to health, right? There's a reason why we are health professionals, we're doctors, and we need to ensure that as we're moving teeth, there's the bone that moves along with it. There are the nerves, there's the vessels in the tooth. So you have to be knowledgeable about knowing why this tooth can move from A to Z and why I can't go that far, because it has to do with the biology. It has to be in a zone where the tongue is on one side, the lips are on one side, the upper and the lower teeth have to meet in a certain position, right, to be able to function. Otherwise, you could actually lose those teeth, right, if you use forces that are going beyond the biology. So it's actually dangerous, and it's really something that we need to talk about, and that's why the 15th of May is here, and that's why I'm here. Right. And again, thanks for giving me the opportunity.
I heard you earlier mention a bad bite, so you guys do take care of that. What does that really mean? Because I have heard that a lot.
Yes.
And I've heard that I have a bad bite, but I feel like I'm fine.
Oh, wow. So, that's true.
Yes.
And that brings back to the function. I'm so glad we're talking about function, and function. Teeth are not just there to look nice, right? So a bad bite is something that we can even see even before you even open your mouth. We can see just looking at the shape of your face that you have a bad bite, because I'll see that either your jaw is too far back or there's some form of asymmetry. And obviously, when I look at the teeth, I will see that the teeth are actually not centered, all right? And when the teeth are in that position, there's a risk of trauma, because every time your teeth are making contact, you're actually transmitting forces that are not preserving the teeth. So you may have 60 or 80-year-old teeth because of the wear, all right, while you are just 30. So you'll be aging your teeth faster. You might be losing your teeth faster just because of that clash you have in your bite. So we have what we call class 3, when the jaw a bit too far forward. And I'm here to give tips to people so you can actually start looking at your face in the mirror and say, what's going on there? Look at the face and the teeth of your children, all right? So there's class 3 when your jaw is forward, the class 2 when your jaw is too far back, and a class 1, obviously, is when we have that normal position. So start looking at yourself in the mirror. Look at your children. How are they speaking? All right? Pay attention to some of these habits where they're sucking their fingers. What will that lead to?
To that number 1 position.
Fantastic. Yeah. That number 1 position. If you're a child and you're growing, there's what we call dentofacial orthopedics, where we guide your growth with appliances to bring it back. If the lower jaw is growing too fast, we slow it down. If the upper is not growing fast enough, we accelerate it, right? So all that through controlled devices, right? And of course, an orthodontist is the only one who can do this treatment.
Okay, tell us, what's the place of teeth whitening in your profession, and then charcoal? How, substances around charcoal, are they useful in any way? Do you use them? Because I see a lot of things on social media these days, and people are like, the night wonder of the world that you've been looking for, as far as teeth maintenance, whitening, etc., is charcoal.
Yes. Well, we're in a world where, and I won't blame people, because at the end of the day, health, that as is described by the World Health Organization, is not just the absence of infection and infirmities. It also has to do with social well-being, right? And people, now we're on camera, so a lot of things are important, having pearly white teeth, white smile. So there's so much demand, about whitening and whiter teeth. So of course, again, you need to make sure that you're guided by a professional. So I'm here as an orthodontist, but of course, I'm a dentist by profession. I've been in this for 30 years now as an orthodontist. So we want to make sure that dentists are the ones that will take care of cleaning, whitening, and giving advice on your oral health, right? While orthodontists move teeth, the restoration and the preservation of your smile is very important. So yes, if you want to use various products, always ensure your dentist is aware and gives you guidance. But I'll say, of course, using black, even toothpaste, will make you feel good, because guess what? Those gums will get a little darker and your teeth will appear a little bit in contrast, a little whiter, and then you come out feeling good about yourself. So it's all about this world where feeling good is so important. And I think we shouldn't neglect that. So as even orthodontists, when we position those teeth, when they function well, they look better. All right? And when those teeth look better, we know that it changes people's lives, right? Yeah. It can, people who are about to go into depression because they're not able to smile, right, are able to live a life and move on, get the job they never thought they could have, or, socialize. So I think it's so important, and we talk about that social well-being, whether done by a dentist or an orthodontist. We're here to help to ensure that we transform your life, and your smile can.
If we look at the pricing of orthodontic care, traditionally it is quite dear, and it does by definition of that price people out of being able to reap the benefits of orthodontic care. When we look at Nigeria, for an example, the fact that just 2% out of every 100 dentists are orthodontists, there's also obviously going to be a scarcity there. Obviously, in a country of hundreds of millions of people, it's going to be difficult for everyone to have access to an orthodontist if they want it. And then even if they are able to identify an orthodontist that they can go to, there's the issue of pricing. In your opinion, do you think that the price of orthodontic care prices the everyday Nigerian out of reaping that benefit?
Thank you very much for that question. So I'm here today as the president of the Nigerian Association of Orthodontists, speaking to the world about what orthodontics is. And of course, because we are few, it explains the fact that it's something that is very specialized, right? And of course, when something is scarce, as we say, there's that demand that is there. But what we're doing as an association is first and foremost to creating awareness. All right, and the more people come seeking for those treatment, the more orthodontists are able to deliver those services as well. There are various levels. We know that the institutions are delivering those services, so you can walk into, Lagos State Teaching Hospital, the orthodontic department is there, and this is what they're doing. There are some private practices who will be high-end. I'm sure there's a level where there's a budget, that can, a treatment that can fit your budget. So it's for everyone to know that is available, and there's a budget, of course. Depends on what you can afford. But we know that dentistry is, I wouldn't say expensive. As long as you need your teeth, you will not count it as an expense. So I will say count it as an investment. The same way for your children, you're paying for their school fees. The next thing is to consider investing in their orthodontic treatment, all right? And it's not just for children, of course. Adults, that it can change your life. You can have a promotion because you have a better smile, a better bite.
I know OG is about to ask a question. I just want to ask one very, very quick question.
Actually.
Oh, was it?
I was going to do a follow-up.
Oh, see, we got that telepathy there. Yes. That's what that is. So Dr. Amy, I wanted to ask, are lisps considered speech impediments, and can they be remedied by braces or orthodontic care?
100%, 100%. There's so much. Again, we're here to bring back the fact that as orthodontists, we're here to drive the function. And if you're lisping, it's because your teeth are not coming together, right? And there's a little space, and that's what we call an open bite. And then the tongue starts going into that space, and when you want to pronounce an S, it's not as crispy just because your teeth are not together. And sometimes it's the opposite, right? So those are the open bite, the overbite that you hear about, the overjet, the underbite. Visit an orthodontist and you'll be able to get to know more. But of course, speaking, you won't be able to pronounce things clearly if you don't have a correct bite. You won't be able to chew. You will be snoring. You'll be having sleep apnea just because your teeth are not. So there's so much that you need to know that the body connects with the teeth and the bite. All right? So it goes deeper than what is out there. But again, that's why I'm here.
I'm just feeding back of Adefemi's question with regards to the cost implication. Now, what is your association doing to try to provide more affordable orthodontic care for Nigerians? Thank
you very much. What we're doing as an association is speaking to health insurance companies. You have a lot of HMOs that are now done a great work in including dental treatment as part of what they propose to their enrollees, right? And we have some few niche health insurance companies that have started paying for orthodontic services. So if that happens, even more, we'll be able to have affordable orthodontic treatment. So this is where the association position itself to be able to push to ensure that more Nigerians could have access to orthodontic treatment. And they deserve it because it is not cosmetic. Yeah. It's not for aesthetic reasons. It's really for the health and well-being of Nigerians.
All right, I know that we've run out of time, but just a quick one. And I know today is a Sunday. Are you having any program at all, to celebrate the day today or maybe tomorrow?
Thank you very much. Today, a lot of orthodontists and tomorrow and for the week will be having some works. We'll be doing some free screenings in schools and organizations and giving some special offers, for people to be able to get to know about orthodontics, even if it's just as an awareness, right? So there'll be a lot of campaigns through schools, organizations to be able to create that awareness. And of course, this is one of it.
Absolutely.
Absolutely.
Thank you very much, Dr. Amy. Thank you for joining us.